Good morning, friends. I am Dr. Asit Khanna, Senior Cardiologist practicing in Ghaziabad. In the next 2-3 minutes, I will be discussing a topic which is generally not well described to you because many doctors, many medical experts tell you what are the precautions to be taken, hand washing, this and that. I will be talking to you about the prophylaxis and treatment for COVID. Important thing to remember that there are a lot of misconceptions and fallacies and apprehensions regarding who should take prophylaxis for COVID and what is the treatment for COVID. The prophylaxis part needs more emphasis because many more people would be requiring prophylaxis for COVID, whereas treatment is ultimately going to be restricted to a very few and it's a specialized subject. For prophylaxis, please remember that as of now, as the day of this recording, prophylaxis is only recommended for healthcare professionals who are coming in contact with known positive COVID cases or coming in contact with contacts of positive cases. Prophylaxis is not for the general public. Prophylaxis is not to be taken by everybody. Prophylaxis is not to be taken on the suspicion of having come in contact with any person with fever. Please do not go ahead and buy hydroxychloroquine from the pharmacy. As it is now, the government has notified it to be a Schedule H1 drug. Now cannot be bought off the counter without the prescription of a registered medical practitioner. Even if you have hydroxychloroquine with you, please do not take it without the advice of an expert who is dealing with such cases. Hydroxychloroquine, the prophylaxis dose restricted to medical practitioners coming in contact with COVID positive or suspected COVID positive cases, is 400 mg twice a day on day 1, followed by 400 mg once a week for 4 to 7 weeks, depending on different criteria. The dose you need not remember because if you are a layperson, then prophylaxis, I am re-emphasizing, is not for you. Coming into the treatment part, there is no known treatment for COVID specifically other than two medicines. One is hydroxychloroquine and the other is azithromycin. These two medicines, again I am emphasizing, are only to be taken on the prescription of a specialist dealing in COVID positive cases. These two medicines are again prescription medicines. Do not take them over the counter. There have been fatalities and complications of people having taken it on their own without supervision. Secondly, they have to be taken only once you are certified to be positive with COVID. Other than these two medicines, there were some time back rumors and speculations that HIV medicines, that is protease inhibitors, are useful, and there have been a lot of studies, small studies all over the world. Some have said them to be successful. There were a few successful cases in Jaipur and in the West, but there is speculation whether they got cured themselves or the antiretrovirals helped. But as of now, the prescription should not contain anti-HIV medications in a COVID patient, as advised by the Ministry of Health and Family Welfare, DGHS, Government of India. The other treatment for COVID is supportive, what we people call supportive treatment, that is the treatment of any person having such a viral pneumonia, whether it includes oxygen, BiPAP, NIV, ventilation, treatment of sepsis, treatment of multi-organ dysfunction, treatment of septic shock, treatment of other complications of a disseminated viral pneumonia. I will conclude my short talk here by re-emphasizing that the prophylaxis is not to be taken by each and every person who has come in contact with a COVID or COVID suspect. He has to get himself certified by a practitioner in dealing with COVID patients. And once he is given a prescription, then only he should start himself or herself on hydroxychloroquine. Please do not hoard it. As of now, hydroxychloroquine is not available at chemist counters and even wholesalers. and that can create a big problem for doctors who need this prophylaxis because they are dealing with COVID positive patients. Thank you so much.